Well, former TV executive Peter Risafi spent years trying to manage a rare disorder called AL amyloidosis. He was broken both physically and mentally until Memorial Sloan Kettering Cancer Center changed his life.
Well, following an investigational treatment called CAR-T therapy, Peter found himself disease-free for the first time in years. He is with us with Memorial Sloan Kettering's attending physician and amyloidosis program director, Dr. Heather Landau. Nice to have you both here.
It's nice to be here.
So, Peter, we were talking during the break. You talked about how you were not diagnosed properly for the first 18 months.
No, amyloid is a very, very difficult thing to...
What is it exactly?
So it is a rare cancer-like blood disorder that affects vital organs, particularly the heart and the kidneys.
How did the two of you wind up meeting one another?
Well, I was in treatment at a different hospital, and it was not going very well. And then eventually, I found my way to Dr. Landau and MSK, and that was the beginning of sort of like saving my life. And that was back in 2013.
What are some of the symptoms? I mean, what were you dealing with at the time?
Well, I was presenting, because I have cardiac amyloidosis, so I was presenting with a lot of symptoms of heart disease. It was hard to exercise. All of a sudden, I was short of breath. It got so bad that even just walking a couple of blocks, I would have to stop and catch my breath. And I went to my doctor, I went to a cardiologist, and they just didn't, they couldn't figure out what it was. And so I had many tests, and they all came up normal. But I knew that I was getting sicker and sicker. Wow. And then just completely coincidentally, we stumbled on the issue, which was that there was something wrong with the muscle of my heart. And that's what led to the diagnosis.
And doctor, he comes to you, and at what point do you think, you know what, this new therapy that we've been working on could be a possible solution? Can you tell us about that?
Yeah, so we have been treating this disease with other therapies for many years. And the treatments are not great. We have only one FDA-approved drug regimen for this disorder, but once the disease returns after other drugs fail, there's really no good options for patients.
But Peter's looking good now?
He's great.
He's great. So you have a new lease on life.
I do. But as Dr. Landau said, I went through all of the, at each point, I went through what the state-of-the-art therapy was. I had a stem cell transplant. And that kept me stable for a while, but the numbers were there. And then I had to go into a second protocol, which was called DARA, which was injections, antibody injections. And that kept me stable for a couple of years. But my numbers kept going up and up and up. Right. So I was thrilled when Dr. Landau said that I was eligible for this clinical study.
So was there a lesson to be learned from this? Because, listen, when you're sick,
yeah.
and I've been lucky, I've been taking care of people who are sick. It's not me. But you have to be an advocate and kindly just like go at it. Like not be, you know.
Well, I think the difference between where I was being treated initially and MSK is that it's truly a team approach. I was never in the dark about anything. We always approach things as a team, and that really helped me. And so it was, because the trust was there, it was easy for me to say, yes, I will do this clinical study. And the difference between this clinical study and the other ones seems to be the other ones managed the blood disorder, but this seems to have a curative effect. Okay. Because for the first time, 1 week after I got this therapy in the hospital, Dr. Landau called me and said, your numbers are gone. It's just gone.
That's crazy.
And it's the CAR-T therapy.
So he got an investigational product called NXC-201, which is a CAR-T cell therapy. And what that means is that the therapy uses your own immune cells, which are first collected and then sent to a lab where they're reprogrammed to fight it against the disease.
It's just amazing.
And then we infuse them back into patients. And as he said, in days to weeks, we see
Wow.
patients respond.
At what point does something like this, because it sounds so promising, and obviously with you, you've seen results, but at what point does it go from a promising option to an actual sort of therapy that you can use for other patients or all patients?
Well, we're hoping, I can't tell you what the regulators will do.
Right, of course.
But we're hoping that with these promising results in our clinical trial, we've seen 95% of patients respond to this therapy.
That's amazing.
And they respond very quickly. And what's even more remarkable is that the side effect profile is actually very manageable and encouraging. Whereas the most common toxicity from CAR-T cells is usually this immune reaction. We do see it, but with this product, it's very short-lived, very mild, and easily managed, and some patients don't have it at all. And the most critical toxicity that happens with CAR-T cells with other products is a severe neurologic disorder that we don't see with this product at all. So our patients are really benefiting. They feel better quickly, and the results are remarkable.
Congratulations to both of you.
Thank you.
You feeling all right, Peter?
Yeah, I feel great.
You gonna get back into the TV business at some
No,
point? I don't blame you. Anyway, I was so happy to share your success story with everybody today.
Thanks. It's really been a pleasure to be here.
Doctor, thank you for everything that you're doing for our community. Dr. Heather Landau from Memorial Sloan Kettering.
All right, best
My
of luck.
pleasure.
Thank you.
Glad to hear it. Love hearing stories like that, sort of like a breath of fresh air, and we have a little bit of that today outside
Spreading the
too,
good
Mike.
news.
Exactly, and some faith that we've got good things ahead, and we do. And